Welcome, Professor Ng. Thank you so much for joining me. You're not only a pediatric endocrinologist, but also a mother of a child that was diagnosed with ASD at the age of 2 years old. From a pediatric or pediatrician's perspective, what would you tell other parents about timing of puberty? For example, what should they do if puberty occurs too early or is delayed?
Thanks, Carla, for having me. So as a pediatric endocrinologist, which is really a hormone expert in children, it's really important for family doctors and parents to know what is normal timing for puberty. And normal timing really is puberty where you have sexual secondary characteristics such as breast budding, pubic hair development, testicular enlargement, and they usually occur between the ages of 9 to 13. In girls, it occurs a little bit earlier. So sometimes you can have early puberty at 8, but essentially you can start developing breast buds and then pubic hair, and eventually menstrual periods starts around the ages of 11 to 14. In boys, just a little bit later, at around 9 to 13, they may develop characteristics such as testicular enlargement, and then pubic hair around the ages of 9 to 14, and other characteristics like underarm hair or deepening of the voice, or growth spurts can occur anytime between 13 to 16 years old. If they fall outside of these, what we call, I suppose, normal time periods, so any pubertal characteristics earlier than 8 or not having any characteristics beyond the age of 13 to 14, then really we would recommend that they be referred to a pediatric endocrinologist for assessments, because there can be organic causes to it.
Yes, of course. Thank you for that. That's quite informative. And I think a lot of parents struggle to know what the signs are, because there are so much information out there, but we don't know what to guide parents to. So it's good to have kind of a bullet point assessment of what is needed and what is the normal course of puberty.
Yeah, I've written a book about that last year, so that's why. It's called Me and My Hormones. So it just talks about what normal growth is and what normal puberty is. And I agree with you, not many people are aware of what is normal.
Exactly. Okay, and that's great. So we can add the link to your book in the comment section below, which could help parents in their journey. What can parents expect during puberty in terms of behavioral changes and changes to the body? How can they support this?
Even in children without autism or without any chronic conditions, puberty can be a difficult transition. I mean, we all remember what we were like as teenagers, don't we? So because of hormonal changes, mood swings are common, emotional mood swings. But in children with special needs or autism, it can be so much more challenging because they don't understand why these feelings are occurring. I've seen a lot of my patients, as well as my own son, have behavioral changes such as increase in aggression. Brendan self-harms, for example, because of anxieties being escalated. And the other feelings that are more taboo, such as sexual urges or masturbations, they don't understand why this is happening. So it's really so important that families and schools support the transition into puberty and let them complete it with the least anxiety as possible.
Yes, on that topic, what can schools do to help this process and this journey with the family?
So in the UK, I can't speak for the US, but in the UK, most schools have sex education at around the age of 11 to 13. But I find that the special schools, the special needs schools, find it more challenging because there's very little material, isn't there, for having it more robust, having it more obvious, and what sex education is. And I found it difficult, to be fair, finding the resources for Brendan. It's important that we use, so I'm talking about more special needs and autistic children, for schools to go through the sex education in the simplified form that is appropriate for their educational levels. So having pictographs, having actual photographs, sometimes using labeled pictures when puberty, what is puberty? What are the bodily changes that occurs? What are, the parts of the body where fluids comes out, such as menstrual fluid or semen? These are challenging even in the UK, and I found it, I had to really look for certain resources to help Brendan, because Brendan's at a much younger age. Even though he's about 16, he functions at a 5-year-old level. Okay. But the important thing is for schools to understand what level of understanding the child has, and to continuously provide sex education, because it's not a one-off talk in school at a lesson. It's a continuous process, and it is the cover of online safety. It's the cover of what happens towards the later part of puberty, warning them about their body changes, and that sort of education is so important.
Yes, I like the strategy of including a lot of visual support and explaining it step by step, because it is so important to understand that this is a normal process, but it is a change, and our kids struggle with transitions.
Absolutely, even as simple as hygiene. In my house we have visual aids of where Brendan needs to shower and clean himself, and we show the underarms, the pubic region, the bottom region, but it's quite explicitly visual for him to and because they're quite routine in their thinking, isn't it? So Brendan follows all these steps. I have a step on how to toilet train, how to keep himself clean after he's done a number 2, for example. But these are really important, I think, and it's very little is talked about.
And I also think that parents sometimes feel that if their child reaches a certain age, that they can take out the visual aids because they're now used to some schedules, but it's not like that, because we all have visual aids. We all have a visual calendar that we follow.
Absolutely.
And if we remember that, then I think it's important that these reminders can stay forever, and that's not a bad thing.
No, I totally agree. Even adults, you and I'm a visual learner. Yes. We sometimes we use diagrammatic things to help us learn, isn't it? So it's well known in the education sector that there are visual learners that learn better with visuals rather than text, for example. And I think, at least for my patients with autism or with Brendan, visuals are so important. I can't stress that enough.
Definitely. And also just the reminders. I have an adult that I work with, and he's got a reminder on his mirror that says, remember to brush your teeth. And it's just
exactly. Exactly. And if you came to my house, there'll be visual pictures everywhere in the bathroom.
That's great.
And the same for Brendan. The step-by-step of brushing teeth, he just needs that reminder. Otherwise, he could put the toothbrush in and out within 2 seconds and thinks he's done. But
he's obviously thinking about a lot of other things. He doesn't want to think about brushing his teeth properly.
Yes.
And you touched on difficult conversations like online safety and masturbation. But what are things that parents can do to help with those difficult phases that a child has to guide through?
I think the most important advice I have is not to avoid that conversation, and then not to assume knowledge. And sometimes I see patients where parents have assumed knowledge, or they felt that the school has done the sex education talk and that was it. I'll give you an example. I had a young patient who told me that when she first had her menstrual periods, she thought she was going to die because, she didn't realize, but yet the school thought they had covered sex education, and the parents thought that we've done
It's
that,
nice.
sex education.
Mm.
So difficult conversations like masturbation, sexual urges, and in later part of their lives, in talking about sexual intercourse and contraception is really an important ongoing discussion to support that young person through puberty, but into adulthood. It is really a common thing. It's really common to have the sexual urges. We will have special needs children going through puberty where parents tell me they start masturbating in public, but they don't realize that's
That's wrong. Yeah.
So it's really supporting them to understand what is public and what is private, and that it's okay to do this. Later on, I'll show you some of the resources. Actually, there's only one that I found that is quite visual, and you might be a little bit surprised by how visual it is. It's in cartoon form, but I've used that for Brendan to say that, it's okay to masturbate, but really not when all the relatives are around.
Exactly. Yeah.
So it is a lot of reassurance using, again, visual aids or pictographs, but telling them that it's okay to do it, but, in your bedroom or, when
and also maybe just to have those clear rules and like you said, the boundaries, because I think that many of our kids that we work with and adolescents and adults, they follow rules quite explicitly, and if there are certain rules, they'll understand and they'll follow them because they do want to fit in and they do want to make friends and they don't want to be the kid that people look at or the person that people look at. So
I agree, but to not make it a negative thing. I think that's how people start getting really anxious when a young child or a teenager with special needs starts. I suppose it's not a social norm, isn't it, to suddenly hump or masturbate in public, but to not cause them huge anxieties and shame. Exactly. So having those conversations early is what I'd advise. And for schools to cover this topic as well, because then you have both sides, the home environment and the school, giving that child or young person a lot of assurance that sexual urges are common, masturbation is common, it's not taboo, but this is where you do them privately, not in public.
Of course, the shame is a big thing, and also like you mentioned with anxiety, because that can lead into a lot of more intense feelings later when they're older. So just making it a normal occurrence, because it is. I mean, we don't talk about it as often, and which is a shame because parents should know about this. And, it's kind of a topic that's very difficult to find resources in. So you touched on...
It is. It's very, very hard to find resources. And sometimes I've had to make them up through, social story programs. But there's a book that I found that helps, but you can expand on that, which I'll go through later.
Yes, please do share any resources that you might have or that you feel that is helpful for parents.
Do I need to do that now?
Yeah, if you want. Yes, please.
So one of the so I said that social stories, you can make it up on your own. So I've done it. So you can use social story programs to create visual aids of step-by-step to showering, having a bath, cleaning yourself after going to the toilet, brushing teeth. Social stories for puberty is much harder. This is a book called What's Happening to Tom by Kate Reynolds, which the female version is What's Happening to Ellie. And I'll show you some of the pictures where it talks about growing up, for example, and that growing up can be normal. So you can see that Tom's starting to have underarm hair. Underarm hair. And
I like the visuals.
It is, but it also talks about, for example, in the morning, Tom gets the erections.
Yes.
And that's, he's wondering why, or if there's semen that's come out, he's anxious about it. This is a little bit more visual, Carla. So this talks about Tom masturbating even, or,
But these are normal things, you know, and this is, I think
I totally agree.
Society has made it such a taboo topic, but
I agree. And when I
through.
first saw it, I thought, wow, I quite like this. I can't find it in a social story because, you know, how are you going to find a cartoon of the pubic region? And okay, another one that is even more pictograph is that, okay? So it talks about what happens when they have sexual urges and things like that. So, so I thought I used that to talk and discuss it with Brendan because it is so important because I couldn't find, you know, really good visuals and obviously it's such a difficult topic to discuss. I mean, Brendan doesn't like to read. And, you know, he sometimes children with autism have what we call Peter Pan syndrome. They don't want to grow up. Brendan has that, you know, and he really didn't want, but I wanted to prepare him before it happened. It's not an easy topic. He used to pluck out all his pubic hair when it came out. And I was like, oh dear, what are we going to do? So, you know, it was a lot of, it's huge effort to do that. And, you know, because he didn't want hair growing. So we used a lot of this, you know, storybooks or pictographs to say, hey, this is really normal, you know, and you know,
I take my hat off for you because a lot of parents they might struggle with bringing up this topic, but again, it is something that we should do, and there aren't a lot of people out there that's really working on that, on this journey, on puberty. Do you feel you've written a book called Your Journey with Brendan?
Yes, yes.
And that was, it's a beautiful story about all the different areas that you're going through and all the different phases that you're going through with Brendan. Do you feel that has made you closer, your relationship more connected with each other? Tell me a bit about it.
Well, a journey with Brendan here is it took me 10 years or more to write it because I used to keep a journal about you know, it's not easy, isn't it? It really is a very challenging thing for a parent. And I was a researcher. I was doing finished my master's and I was doing my PhD. And, you know, Brendan was diagnosed at 2, nonverbal. So on the severe spectrum, high support needs. And everything was a challenge, from weaning him to getting him to eat normal foods to taking 8 months to toilet train him with every effort possible. So definitely, I think, you know, writing the book helped me because about 14 years ago, there was even less resources, you know, and I'm a researcher. The book is about my journey with him, bringing him up over the last 10 years, going through all the stages of weaning, toilet training, and there's puberty in there as well. But it also gives me that sort of information that I've researched, I suppose, as an academic and a consult as a pediatrician, as a hormone expert, to help me gather everything I know and have researched and have read and to put into place what worked. You know? And some things might work for others and some things might not work for others, but essentially we try, isn't it? We try our best to do what we can.
You take from what has worked and you can learn from other people's journeys as well. I think it's a very important process, coming from a psychologist's point of view, to write it down and to know that was your journey. These are the things that you feel that you did really well, and these are the things where you needed more support, because that in turn helps other parents, but it also helps you, I feel like.
Definitely. It was my own way of coping, isn't it? And you can see in the book I've written, you know, it wasn't easy, but we cope and we carry on, because this young child, you know, depends on me. You know, I have 3 children. My second son was born deaf.
Oh, right.
My daughter was born premature. So, you know, at one stage, 3 children under the age of 5, all needing a little bit of extra help.
Oh, wow. How did you do it to continue studying and in your field and your career?
You know, if I had a penny for every time somewhere, I don't know is the answer. It's you just carry on. You just carry on.
One day at a time.
Yes, exactly.
And then parents, we work with many parents and they enjoy the theoretical side at times, but they appreciate practical advice and strategies a lot more, as you can imagine, because you yourself are a parent. Do you have any final top tips that you feel has made Brendan's life easier or your entire family's life easier approaching puberty now as he is 16?
So I suppose my top tips for parents, families, teachers is one, be open with the discussion, to continuously have the discussions about puberty. Don't assume knowledge. Don't assume the other person, the school's done it, or the school assumes the family's done it. And use all sorts of resources to help you. Visual aids, I can't emphasize it enough because I find visual aids are explicit. There aren't words jumbled up in their heads that confuses them. So pictures, pictographs, even if you have to draw your own stick diagrams, that might be even better than using lots of words or text to help them understand puberty, isn't it? The next phase as they grow up and understand that the body is changing normally is about teaching them safety, to say no, to know what is private, to know what is public.
So important.
It is so important. And if they don't have that ability, ensure that online safety is, available at home, that they don't suddenly access, unsafe sites and things like that. And that's an important thing, I think, in this day and age, to teach them about personal safety. And as a pediatrician, child sexual exploitation is common, sadly, amongst people with special needs. So do not be naive, I guess.
Yeah, and from a young age, I feel like that should be taught, because we're finding it with our young children as young as 8 years old, where they go online, they might even have an Instagram account or some other social media platform, and there are always people out there that you need to be cautious about. One of my older friends actually mentioned that somebody wants to come and play an online game with her at her house, and she's highly educated. She's a medical doctor, but she's on the autism spectrum. And I spoke to her and I said, this is dangerous. You should be cautious about a situation like that. It might be totally innocent, but you never know.
But not be naive. Exactly. But not be naive. And I suppose my final tip is involve your young person's curiosity. Have that open discussion and not make the subject of puberty or the more difficult conversations like sexual urges, masturbation, don't make that taboo such that they, like you said, it's not about being ashamed of it. It's, having open, honest, and ongoing discussions with your young person. Support them, I guess.
I think it's also important to let them understand that, or help them understand that they can speak up, they can ask questions, in whatever shape or form they can ask a question, and that's 100% fine. And if they're comfortable at home, then they will be able to be more of an advocate and be more assertive for these urges.
Absolutely. It is not an easy change, and it's not easy for even what we call neurotypical young people.
Exactly. That is such a good point.
To understand that it can be then more challenging, and that children with autism or special needs requires that little bit extra support.
Amazing. Thank you so much for your practical strategies and tips. I think parents are going to get quite a lot from this short chat that we had.